Good evening, everyone. Thank you all for joining us this evening. I am Dr. Minerva Romero Arenas. I'm an endocrine and general surgeon at New York Presbyterian-Brooklyn Methodist Center and an assistant professor of surgery at Weill Cornell Medicine. I'm also one of the founding members of the Latino Surgical Society, and on behalf of the founding members, I want to give you a warm welcome and thank you again for joining us for tonight's webinar. The organization, the Latino Surgical Society, was founded to cultivate, nurture, and promote the advancement of Latino surgeons. And we are very happy to have everyone join us for the Latino Surgical Society inside the operating room. We'd like to acknowledge our institutional members. Our institutional members that you can see featured in this slide: the University of Washington, Seattle, the University of California, San Francisco, the University of Texas, Austin, Massachusetts General Hospital, Oregon Health Sciences University, and UCLA Harbor Medical Center. We especially want to thank you for your commitment and support of LSS, but also for the commitment that you've shown to your faculty and learners at your institution with this institutional commitment. We also would like to thank the recently appointed advisory board members, Dr. Cubano, Dr. De Virgilio, Dr. Hyder, Dr. Rodriguez, Dr. Pellegrini, Dr. Solorzano, Dr. Sosa, and Dr. Sotogreen. I'd also like to highlight some recent developments in the organization. Your Latino Surgical Society will be starting interest groups. Our first interest group will be towards trauma, critical care, and acute care surgery. This will be led by Drs. Joseph Fernandez Mode of Duke University and Richard Sola of Emory University. Additional interest groups will be formed based on our members' choices and career stage, so please look for additional information via email and social media. We also will be reaching out to our members to start organizing our committees to help further the mission of the Latino Surgical Society. Last but not least, we'd like to thank you, all our members, for supporting and believing in the LSS. Please be sure to visit our website, latinosurgicalsociety.org, and connect with us through our social media pages. Check out the latest opportunities, such as our LSS Career Center and Job Board. And now I would like to share with you a little bit about our guests tonight. First, I'll be introducing our session moderator, Dr. Michael Galvez. Dr. Galvez is a board-certified plastic and reconstructive surgeon, specializing with specialized training in hand and upper extremity. His parents immigrated from Lima, Peru, and he grew up in the Bay Area in California. He attended community college, then transferred to UC Berkeley, where he received his bachelor degree. He received his medical degree and completed residency at Stanford University. His residency was in plastic surgery, and he then completed 2 hand surgery fellowships, one at the University of Washington and the second one at Texas Scottish Rite Hospital for Children. He's the director of the Pediatric Hand and Upper Extremity Surgery at Valley Children's Hospital in Madera, California. He's an awardee of the Cal Healthcare's Loan Repayment Program, which is aimed at physicians who provide care to Medi-Cal patients. He values the importance of true mentorship and diversity in medicine. So welcome, Dr. Galvez, who is also a dear friend. I'm really glad you could join us tonight. We also have the distinct pleasure and honor of welcoming Dr. Linda Cendales for our 6th installment of the Inside the Operating Room series. Dr. Cendales is a professor of surgery at Duke University School of Medicine. She earned her medical doctorate in Mexico City at the Universidad Autónoma Metropolitana and completed surgical residency at the Hospital General de Dr. Manuel Guea González. She's the only person in the United States to have completed formal training in both hand and microsurgery and transplant surgery. She's an associate professor of surgery and orthopedic surgery at Duke University, where she also serves as the director of the Vascularized Composite Allotransplantation at the Duke University Medical Center. Vascularized composite allotransplantation, or VCA, is the transplantation of multiple tissues such as skin, muscle, bone, nerves, and tendons as a functional unit, such as a hand. Dr. Cendales helped organize the first VCA team in the US and participated in the country's first 2 hand transplants. She was subsequently the first surgeon accepted into the Transplant Surgery and Immunobiology Fellowship at the National Institutes of Health. During her time at the NIH, Dr. Cendales established and published a model of VCA in non-human primates and has one of the largest experiences in VCA in non-human primates reported in the scientific literature. Prior to joining Duke, she established the VCA program at Emory University and led the multidisciplinary team that performed Georgia's first hand transplant in March of 2011. Dr. Cendales is the principal investigator of clinical and translational studies in VCA funded by the Department of Defense. She's also the past president of the International Society of Vascularized Composite Allotransplantation Society, the chair of the Organ Procurement and Transplantation Network, the co-chair of the American Transplant Congress, the chair of the American Society of Transplantation VCA Advisory Council, and an associate editor for clinical transplantation. She has co-authored countless scientific manuscripts, abstracts, and invited publications. Dr. Cendales, bienvenida. I'm going to turn it over to Dr. Galvez.
Awesome. So what I love about hopefully our discussion, Dr. Cendales, is just really going into your story. And I think that was the part for me that was the most impressive. I was a plastic surgeon interested in hand surgery, and I literally had never met a Latino or a Latina hand surgeon in the United States until I interviewed for hand fellowship and met you. And just incredibly impressed with your story and just how much you have accomplished. And even since I finished my hand fellowship at Duke. And so I first was hoping to start about talking about your background and just where did you come from and what, and I know from Colombia, but where just growing up as a kid and what got you to the point of getting interested in medicine and from there forward.
Mil gracias por la invitación. Es un honor para mí, and I'm looking forward to, to this hour sharing a lot of stories and of course, helping us as much as I can to, moving forward. I feel really honored on this invitation. So, so Michael, as you said, I was born in Colombia. I was born in Bogota, and I finished high school. And in Colombia, we have a national test, the ELICFES, that we all take in anticipation to going into university. And I took it as part of it's compulsory for all of us. And I did well nationwide, and so I won a scholarship. And I chose, they gave me 5 choices to do college with the University Colleges, my international baccalaureate. And I chose to go to Southern Africa, to the Kingdom of Swaziland, which is now called Eswatini. By the time I went to do college, I was the first Colombian ever in that school. I had already made the decision that medicine was the career path that I wanted to take. And how it came about is I was not born knowing this, or it wasn't when I was small. How it happened is I was in high school and I knew that I wanted to do something to take care of people. I wanted to take care of people as my career. And my mother was a professor at the university in Bogota, La Universidad Javeriana, and she's a PhD in history, and so she was working through the medical school, and then she saw, a course that he was giving in first aid, a first aid course, and then she came home and she said, well, there's a first aid course at the university, you want to take it? And I mean, I was like maybe 15 or 16, and I said, sure. and I took it after school for a week, and that was it. I said, this is it. This is what I want to do. I was so energized, and I couldn't wait, to go and learn and all this. Then I went to college in Swaziland, and we were 350 students from 72 different countries. So, of course, diversity for me is the norm. It was just a wonderful experience. I volunteer in the government hospital. I learned sign language to be able to communicate with the kids in the pediatric ward, and then I wanted to also communicate with the people who used to take care of our college in Mbabane, Swaziland, and so I learned from them Siswati to be able to just communicate directly. And then I moved on, and as Minerva said, I went to Mexico City, where I did my medical school.
Yeah, that's incredible. It's those opportunities that you take on, and it can be as simple as a first aid class, right? That you just took on and were inspired, and you kept moving things forward. And so, yeah, that experience that you had is definitely unique, with the diverse amount of people that you must have interacted with. And I find it fascinating that you were doing sign language, right, with your hands, and now you operate with your hands, and you're a hand surgeon, and you help bring patients the ability to use new hands with transplantation. So that's really incredible. And so, as far as, if you could go into the specifics about how, when you were in Mexico and you were training to be a physician, and then in surgery, how did you make that transition from deciding to train in the United States? That's a common question that I get from foreign medical graduates in making that transition. What was that like for you at the time?
That's a good question. So I have to say that my family live in Texas. So for us, basically, our careers were going to be in the United States, just because my family moved to the United States. So I think for me, and I was actually, we were planning, I was actually already coming to the United States to do college right after high school. And for me was probably a different path, because then I sort of deviated to go to Africa and deviated to go to Mexico on my way to here, because the plan was to come here and starting my college in Houston, where my family is, and then I got the opportunity to go to Africa, and then the opportunity to go to Mexico, and that, which brings up the really good point that you made about opportunities, and about being open to take those opportunities. Or I never stopped the goal, but my path took me to so many different angles that I never envisioned. It wasn't that I planned it. I had sort of, I wanted to be a surgeon, and I, then hand surgeon, and then, based on research at in Mexico City at the National of Nutrition, that I did a year of research, because I've always been very interested in answering questions through the scientific method, is when I thought about a hand transplant for the first time, before I had spoken with anybody about hand transplantation, or even thought about it, or had even done the first one in the country. As you know, I participated years later. So it was something in my mind already, but I was open to be exposed to different things. I do think that, and this is something I continuously sort of mentor people around me about the importance of exposing oneself to a lot of options and a lot of things, and then at the end, decide what is the best for each of us. And I think that has been a constant denominator in my career. Of course, in retrospect, it's easier to see things, but I have been consistent on that. I've been always sort of sort of open without losing sight of where my goal is.
Yeah, wow, that's incredible. The was there a specific opportunity that led you to the Kleinart Institute?
Yes, it was. And this is also being consistent. And if I just take a 1 minute to put in context, so when I was in Mexico City, it was the time to do el servicio social, and I wanted to do it in research, and so I searched and did my homework, and I wanted to do it with Donato Alarcón Segovia, who is a pioneer who wrote a paper in Nature at that time. He actually described a molecule in immunology, and so I was very intrigued, and I wanted to do it with him, and I was accepted, and so I did. When I was then looking into hand surgery, I did, of course, search around, and Harold Kleinart and its group. As you know, Harold Kleinart was the first hand surgeon who did a revascularization of a thumb ever. And so I wanted to be at a place forward thinking, pioneering. For me, it was sort of the best place for me. Also, the different angles, as I said, I like looking at things from different angles, and invite the diversity of intellect and diversity of background. And the Kleinart Institute, half of the fellows were international, half of the fellows were from the United States, but also the attendings were from all over the world, extraordinary surgeons at what they did. I mean, Atasoy, who described the Atasoy flap, as you know, and we use, routinely, Kleinart and Sai and Shaker. I mean, everyone who was really, really good, but coming from different angles. And so for me, that was something important. And so that's what I wanted to do it at the Kleinart Institute. And I was very fortunate to be accepted. And then, of course, as a fellow, participated in the first hand transplant in the United States.
That's incredible. Yeah, that's the part that I've always have been very fascinated about the Kleinart Institute, and how they have brought in people from different parts of the world, right? And they bring specific expertise that you can't just get out of a book. You can't get out of just one type of person. And so that must have been an incredible experience, especially with the research component too. And so from that end, who have been your most important mentors and sponsors? And I'm sure there's likely many, but if you could highlight some specific ones that have helped you to get to your position.
Yeah, well, so as I said, Donato Alarcón Segovia, who passed already, he became the director of the National Institute of Medical Sciences, Nutrición in Mexico. He was my mentor in medical school. Mm-hmm. And of course, at the Kleinart Institute, Harold Kleinart, Joe Kutz, Louis Schecker, Sumin Said, Wolf. I mean, they're really great surgeons, all my attendings at that time. Then it was clear to me that the problems in hand transplant were not technical, but in the immunosuppression and immunobiology. And then that's why I went to the NIH and trained with also a mentor, a very important mentor in my career, who is Alan Kirk, who founded the program, the transplant program at the NIH, at the NIDDK, and started the fellowship program. And I was the first fellow. I was honored to be the first fellow. So he has been also an important mentor in my career. I mean, as you know, he's not one mentor for one thing. There's several, but there are not that many either, right? There's
key one
components, right? But those have been very important to me in my career.
That's awesome. I always think that that's something that I speak with a lot with students, and just figuring out who can help you and who can support you and sponsor you to get to that position. And so as far as your current practice within hand surgery, within hand transplant, how did you end up and decide on settling at working at Duke?
So what I do in my research is of course it's a niche, right? Because the development of the field right now, we're still in the proof of concept, and we're sort of transitioning to phase 2 and doing a little bit more of the cost effectiveness, but it's still under research.
Yeah.
And there, you know, there are institutions that focus on different areas, and for what I do, you know, Duke is an institution that that has sort of a lot of the components, you know, to develop this field. For example, the non-human primates, right? Not all institutions have non-human primates. Of course, the basic lab, but also the clinical enterprise, the support for research, and the forward thinking, and also, you know, the opportunity, right? Is an institution who was interested in establishing a BCA program, which there are not that many in the United States comparative to other programs, as you know, actively that have done a hand transplant, probably less than 10 in the United States in the past 20 years, because it's a low volume, you know, high risk, high reward. So there were many things that, of course, you know, my lab moved also to Duke, and so there were a lot of components. It was sort of the next step in my career, after my first job as a fellow, which was Emory.
I see. Yeah, the that infrastructure is so important to, especially with something that is as complicated as, I mean, I just think of just the field of immunology in itself is complicated, right? And when you get to the point of coordinating care and medications and the surgical care, it's really those aspects are so important. And so, yeah, your leadership in that area, in the area of hand transplantation, is really remarkable. And one of my mentors was Oscar Salvatierra at Stanford, and I see all these associations and co-chairing all these important efforts, right, and the proof of concept and bringing things forward, and it's really remarkable because we see the difference that you can make with these patients that don't have much sometimes, and you're able to give them the ability to feed themselves and take care of themselves and do their activities of daily living. So that's really awesome. And so what would you say from in your research and in your proof of, you know, not just a proof of concept and actually taking care of these patients, what do you think are the most important lessons that you've learned in your journey to practice vascularized composite allotransplantation?
That's a good question. I think perhaps if I can generalize a little more in my career in general, there are a couple of things that come to mind. One is, of course, you know, finding the passion, right? Finding what you really love, and that, you know, I have found it, and that's something that has been, you know, very rewarding. Um, Working hard is another thing that I would say it's, you know, it's important, um, and being consistent, right? And do things for, I mean, so for example, I have sort of, as you know, dedicated my academic career to this, but for me it's just the passion of answering the research questions with the scientific method. I've never thought of proving something, right? I've just been answering you know, raising a question and then say, well, I wonder what this happens. And then, you know, it takes you one place, and then 3 years later, you realize that it didn't work. And then 4 years later, you are in a totally different place. But that is the path that I find fascinating, right? That is something so new. We have more unknowns and knowns that just just looking at the data and just following where the data sort of gives us or takes us, it's fascinating to me. I have also been able to, I've also been fortunate in being able to be um, in a place where I can contribute to where I think the field should go from a leadership position. Because for me, safety and implementation is important. So I've been able to be, of course, as you know, with the OPTN, developing the policy of how to implement this field in the United States. Because as you remember, years ago, people didn't know how to call us, and it was called composite tissue allotransplantation, and then we sort of worked towards defining this field under organ transplantation and then changing the name. And so I've been also involved, which I think I have enjoyed through a service component, from my service part. And then of course the teaching, right? The future of this field is for those who will have an understanding of both, right? The reconstructive part as well as the immunology part. And how I look at it is, I work as much as I can and then pave the way for the next generation, for your generation to take it wherever it's going to land.
Yeah, the immunology just blows me away. There's so many components, and the research side is just from making changes in medications and thinking of receptors. I just think of how complicated that is. But it's important because it directly affects the patient, right? And affects their outcome and how, and the viability of their transplant. And so and I have some questions on just moving forward in training and giving some insight for some of the students and the residents that are hoping to become transplant surgeons or hand transplant surgeons or hand surgeons. And so throughout your training and practice, how do you think surgery has changed? Do you think it's been for the good or for the bad as far as the training?
I think clearly, training changes with the times, right? And we are in a different time, but I think you are in a very exciting time right now with a lot of technology coming up, and so many different tools and resources that I didn't have when I was in my training. I mean, technology, of course, has speed up, and then of course COVID has also helped, right? That technology but machine learning, artificial intelligence, the ability to to do robotic surgery at distance. I mean, there are just so many, in that regard, that has really opened a lot of opportunities and paths and future for us right now, and clearly for you as the upcoming leaders. That had changed. I think also the restructuring of the hour work, right? It has also, it's a component of it as well, which needs to be taken into consideration as well. I think for us as surgeons, we have the pathology in our hands, and so the opportunity to operate and to have the disease in our hands and be able to take it to the lab and study it and figure it out. It's something very unique of surgeons that is an amazing opportunity that brings with it, endless approaches and discovery as well, because we have it in our hands. We can take it out.
Yeah, that is definitely the just that research mindset, of just thinking differently rather than thinking about how to come up with a new solution, rather than doing it the same way, and focusing on, just because it works, just because we've done it that way, that it needs to keep going that way. As far as your professional ties, and as you've ascended and gone into academic surgery, do you still maintain connections to in Colombia and also in Mexico?
I do. I do, and that is something that is precious. I think one of the perhaps opportunities that the current or the last year brought was that the the technology actually, for me, made us even closer, right? Because I have so many friends all over that the facility and just the easiness to just do a Zoom has really made us even closer, which is an angle that I have appreciated, right? The ability to be connected, and the easiness to just jump on Zoom and also see how everybody's doing. So I do I do continue in communication with friends, and not as often as I would like to, but I do.
That's great. Just an interest from me, just an interest that I have is, how are comparatively, United States has, like you mentioned, all the different types of transplants. As far as Latin American countries, is there a specific one that is more advanced, or is closer, or is actually performing hand transplants or face transplants?
So the current experience in Latin America with VCA varies from, so Mexico has done bilateral upper extremity. Actually, Mexico was the first country in the world that did the first pediatric upper extremity transplantation in a 17-year-old girl. Um, and so upper extremity in Mexico, of course, Brazil did the first uterus transplants from a deceased, right? They were the first one who reported. So so that's that's pioneering. And interestingly enough, it was in Ecuador in 1964 that the very first hand transplant ever was performed, before the era of cyclosporine, and then the hand transplant was lost within the first 2 months due to subtherapeutic levels of immunosuppression. But still, it was in Ecuador where the very first one had been done. So they are, they are, of course, pioneers, right, in Latin America for VCA.
Yeah, that history is so important. I do remember that first went there, but it was a couple of weeks, you said, right, that it lasted.
Right. And I mean, just to go on, of course, in Colombia, they had done trachea transplant, esophagus, larynx, and so that's also sort of in the pioneer realm. So it's good to see that.
Yeah, that's great. That's awesome. As far as getting into training surgeons, which is what you do, like you mentioned that this coming weekend, right? You're on call for hand surgery, which we all know, all hand surgeons know, that the 4th of July is unfortunately a very busy weekend, because we see some really terrible disasters that happen. But my question was, what is your teaching style in the operating room?
For example, one thing that I always love, and I tell people around me, is I love when someone comes and has never done whatever it is that we're gonna do. I mean, that for me, and I think it goes, of course, as my personality. I am a little bit more on the side of the first doing and trying to figure out things in the discovery. I'm more in the discovery phase than in the, for example, population, and big data type of
research. Yeah.
and so I love when somebody comes and then I ask, have you done a carpal tunnel, or have you done a replantation, or have you, and then the student says, or the resident says, I've never done that. And I love that. I love walking people through that first experience, because there's only one time that is the first experience doing something. And so I enjoy that very much. I like walking people through either the procedure or the the technique, or I like that very much. I like being a really good first assist, um, because it's fun. It's fun to just walk the person through, because I also enjoy when they feel accomplished with what they do. When they feel successful, right, of that they did something that they hadn't done, or that they did it well, and that they're building their experience. So for me, it's that is a reward, and so I enjoy doing that. So that's sort of some of what I do.
That's awesome. I really should have done my fellowship at Duke.
I think, yeah, probably.
That's my biggest regret. And so another question is, if you could give your younger self some advice, what would that be?
Knowing what I know now, I assume, right?
Yeah.
Wow. I have.
We're giving you tough questions here.
Yeah, very tough. I haven't thought about that. Hmm. I don't know. Probably one of the things that I still have sort of in my mind is a little bit of this time management, which I still, work on every day. I'm getting much better at it than I was when I was young, but I think a little bit of time management, so that I could probably balance a little more, the time and the productivity, also with the
Work-life balance.
the time to spend with people you care about, right? Of course, I train in a very different setting in terms of of work hours, right? So there was very little that I could actually control.
Yeah. What do you hope for a rising Latina or Latino student aspiring to become surgeons? What do you hope? What do you think? I guess the question is, what do you for students that are Latina or Latino that want to become surgeons? What advice do you give for them?
So first of all, of course, surgery is your passion, right? And that everything else will fall in place. Work hard. Your talent will be evident, right? So just work hard, find your passion, be true to yourself, and everything else is going to fall in place. Everything will fall in place with that. And of course, if you are on the research component of it, just look at things differently and create something new, and just go after that without even thinking twice. Things will fall in place.
That's awesome. Thank you so much, Dr. Cendales. I really appreciate the discussion. I think we're going to transition now to Minerva.
Wonderful, Doctora. Thank you so much for your honesty and for sharing with us your amazing path in surgery and in transplant and BCA, which is relatively new for me. I'm learning a lot today. We would like to ask you some what we call rapid fire questions. So you're supposed to just let us know what's the first thing that comes to mind.
Okay.
What profession other than your own would you like to attempt?
Oh, I would love to be a great musician.
What instrument would you play?
I don't know, probably piano, but because it's hard to take the piano everywhere, so maybe guitar. It's just easier to travel with a guitar.
Yes, it's also very poetic to travel with your guitar.
Yeah.
What is your favorite word?
Trust, probably.
Okay, and least favorite word?
Probably the opposite.
Mentiras.
Probably distrust or dishonesty, maybe. Mm-hmm.
Okay, fair. What is your one pet peeve in the operating room?
My one
pet peeve, the one thing that no one should do in your operating room.
Probably be disrespectful to others or to anything. Yeah.
Okay.
Yeah, that's very unattractive to me.
That's great advice. What activity re-energizes you?
Swimming, probably.
Okay. What's the best gift you've ever received?
Many, but time and care, probably.
We all know the value of that.
Yeah.
What's your favorite part of the hand transplant operation?
The surgery as such, or the procedure in general?
Probably the procedure or both.
Yeah, well, I think I will always be thrilled when we release the tourniquet and see that hand coming on, right? I mean, that will always thrill, no matter how many million times I'll do it. And in general of the procedure in general, probably it's very rewarding to actually see the patient using the hand. You know how we transform lives.
Yes.
That's very rewarding.
Yes. I can only imagine that. What's your favorite brachial bundle?
Brachial bundle. These are hard questions. I don't know. I think I'm going to pass on that.
You can get back to us. What sound or noise do you hate?
Oh, probably like heavy metal music.
Oh, okay.
Yeah, that's a bad idea in the OR as well.
All right, since you brought up music, Orquesta Guayacán or Grupo Nietzsche?
Oh, Grupo Nietzsche, for sure. No question.
Okay, and quesadillas with queso or without queso?
Oh, with a lot of queso.
What kind of question is that one?
You have to be. It's a big controversy in Mexico. So
funny.
What sound or noise do you hate?
Let's see, probably taladrar. How is that in English? Like
taladrar. The drill?
Yeah, drilling in the wrong place.
Okay, what's your favorite season?
Spring.
What profession would you not like to do?
Oh, I would be a failure in painting. A painter, I would be just a failure. Or ceramic, so yeah, I would really be bad at that.
I think you might be surprised with as much work as you do in hands. You might be pleasantly surprised. Is there one thing you do every day?
That I do every day? Yeah, I try to be sort of rewind what happened during the day, like things that went well and things that probably could have gone better. So I think that's something that I usually do, particularly like when I'm driving home, sort of rewind a little bit of what was going on during the day.
Oh, that's a great practice. Okay, wonderful. Thank you so much for answering these questions for us. We'd like to transition now. We do have a couple of questions from the audience. I'll ask the first question, which comes from Andres Urbano. Doctora, what are some qualities that make medical students stand out in surgical rotations, particularly away rotations? And are there any characteristics that you look for in medical students?
Yeah, so I mean, of course, enthusiasm. It's always nice to see people when they come prepared, right? To know about the procedure or have learned about something about the procedure and are prepared. That also speaks, loud. Being kind, that's important too, which for everyone is just sort of be yourself. Be on time, that's also something that that would be sort of important. And whatever it is that you're doing, just concentrate on the moment, right? If you're in the operating room, you're in the operating room. If you're presenting a case, that's your focus and present it well. So basically, sort of like one astronaut used to say, perfect the moment. Whatever it is that you're doing, just do it the best you can, and that will be just the best that you can do.
That's excellent advice, and I think it's something that we can't stress enough for our learners. We have a second question. What is one skill that you didn't anticipate needing when starting your medical career that you now have gained as a practicing surgeon?
That's great. So that's a really good question. So when I was in medical school, for example, I never had any guidance or any course or anything, for example, on negotiation or conflict resolution or how to, all these soft skills that now are part of curriculums in many places. So I didn't do that. I sort of learned as I went, right, with trial and error. And so developing those soft skills is something that I didn't have, that I have done over the years, but then I try to emphasize in my mentees.
Yeah, that's excellent advice, and I think it's being more incorporated, as you mentioned. So I hope everyone can take the opportunity to look for those opportunities for learning when you encounter them. I do see perhaps one more question, and this comes from Nusaiba Baker. What, in your opinion, are the main barriers to seeing more Latinos in surgery, and how do we tackle them?
Yeah, so so we of course want to see more numbers, and I think now it's it's turning a little bit better than, for example, when I was in residency. One thing that I always is support each other, right? And that's an open doors sponsor, right? That is important. So I think reaching out to to people who we will all be very welcoming and sponsor of that. And another thing that I think is in general is just be good, right? Your talent is gonna show up. You won't need to do much more than just be honest and work hard, and a lot of things will fall in place. But for example, this society is an example of something great, right? Getting together and support each other, but also connecting us, right? I mean, there are just so many great Latinos and Latinas that we just don't know about, and sort of these societies like this that connect us, that put us together, that are resources for our for our community are invaluable. So I really applaud that, and that's a really great way to put us together and help each other.
Yeah, I think that's an excellent point, and that's exactly why we established this organization. I think we are getting close to the top of the hour, so I do want to be respectful of everyone's time. I would like to thank you, Dr. Cendales, for joining us for our 6th installment of Inside the Operating Room. Thank you, Dr. Michael Galvez, for joining us and for moderating this session. We really appreciate your time and efforts in this collaborating with us to do this session. I'd like to thank our audience who tuned in this evening. This really concludes our first season of our Inside the Operating Room series. We will plan a return in the fall with more intimate features of Latino surgeons leading our field. If you're interested in learning more about our organization or becoming a member, you can find us at latinosurgicalsociety.org and on our various social media platforms at Latino Surgery. The recording of this webinar will be available shortly on our YouTube channel, Latino Surgical Society. Thank you, everyone. Buenas noches.
Thank you.
Thank you.